Hello, my name is Stephanie Barnes, and I'm going to be doing my presentation on vulnerable population. So over the weeks, we've been talking about different populations in the community. All are related to vulnerability. So I'm going to explain that. So the vulnerable population is a group with increased risk for advantaged health outcomes, where they're more likely than the general population to suffer from health disparities. A goal in the United States is to eliminate health disparities by expanding access to health care for vulnerable or at-risk populations. Vulnerable populations are people with lower incomes and less education, and they tend to be at higher risk for health problems. So vulnerability, it does relate to poverty, homelessness, which also goes down to mental health issues, which also goes down to infectious disease. Homelessness also has a relationship with addiction. Addiction has a relationship with violence. Um, Poverty, it's kind of has a relationship with migrant health, because the migrant health, they come over and they don't have the resources and they're scared to go to um, the hospital because they might get back deported. So they're leaving from where they are because they're in poverty, but they're coming over here being scared. So they do have a relationship with infectious disease also. I don't also think poverty has a relationship with living in the rural settings, because it's just like, countryside. It's just a way of living. So poverty, uh, the definition, it varies depending on the source. The federal income government defines poverty on the basis of income, family size, age of the head of household, and the number of children are under the age of 18. So they define some families that uses temporary assistance, women, infant, and children assistance, things like that. They consider those people in the poverty community, or population, should I say. Um, when somebody is in poverty, they don't have the resources to advance their education, or maybe to get to a job interview, or things like that. And then sometimes they give up and they don't have anywhere to go. Their family are not really supportive. They become homeless. Um, your homeless population, they can be anywhere from living really on the streets, in the alleys, under the bridge. They could be just living really house to house, like maybe I can spend a night here, or living in their cars, anything like that. All in all, they don't have the accurate resources to be healthy. So some of these homeless people, they get they start doing drugs. They become addicted to drugs, and drugs will make them lose their mind, literally, and then they become to have mental health issues. They sometimes can get help from having mental health issues, and sometimes they can't. And sometimes people don't take them as serious as they should, the mental health issues. If they come to the hospital, they treat them for a little bit of time, and they let them go back on the streets, and they're going to be doing the same cycle. They're going to be on drugs, and then they're going to be involved with the violence to try to keep that drug addiction up, and it's just going to be the same cycle. Homelessness, they are prone to have infectious diseases. They are a big population because they're not able to take care of themselves. They share needles when they have doing drugs, which would transmit HIV. Because they're living outside, they have a high risk for hypothermia or heat-related illnesses because they're outside during the winter or the summertime. Poor skin integrity, which leads to open sores, infection, and sepsis, and then eventually death. They go through respiratory infection because they're out there with different populations. Sometimes they could get tuberculosis, and then that can kill them. It's a lot of different things that homeless people acquire from being outside. The mental health, the prevalence rates for mental health problems are very high, and people are at risk for threats to mental health at all ages across the lifespan. At-risk populations, low-income, minority groups are often at risk or increased risk for mental health because they may lack access to service. They are usually on have substance abuse. So some of the prevention that we can do for them, like primary prevention, we can promote healthy lifestyle or drug education. Secondary, we can do assessing the ATOD problems and screening. Third is to detox treatment and support groups. So violence in the community is a nursing concern. Significant mortality and morbidity results from violence. Nurses can also take an active role in developing community response to violence through working on public policy and needed resource. Some factors are stress. It can be stress from being homeless. It can be stress from problems that in your house and you don't know how to cope with those, so you go out and ruin somebody else's things. You break into a car because you see something you like, or you go into somebody's house and they're there, and then somebody's going to get hurt because they're going to try to fight back for their things. Religion could be a part of it, social community behaviors, learned behaviors. The gang community is really big, so they definitely have a part of violence. And they also go back to some of the things here. They can be coming from poverty. They can be coming from mental health issues. They can be coming from addiction. They can be coming from being homeless. All these things really relate to each other, and it all comes from being vulnerable. What nurses need to do is try to identify these problems as soon as possible, try to set up programs, encourage these populations to just do the right thing and hang in there, and try to get into programs and rehabilitate and break the cycle. That's my presentation. Here are my references. Thank you.